Mi nombre es Nelia Aguilera y soy investigadora de la Conferencia Interamericana de Seguridad Social en temas de sistemas de salud, de pensiones y de mercados laborales. For me, the right to health is people should contribute to the system according to their means and should receive care according to their needs.
My name's Christina Angela Ntulo, and I work for Basic Needs Foundation Uganda. My definition of the term right to health is about every individual being able to, by entitlement, lead to a certain extent or have an equal opportunity to a healthy life. It doesn't necessarily mean that we all start off at the same level or at the same place, because some people are born with certain difficulties depending on also the socioeconomic situation that you're born in. But at the end of the day, the opportunities available for all of us in our environment should be able to support us to live a healthy life as much as possible.
I'm Maha El Rabbat. I'm from Egypt, professor of public health, faculty of medicine, Cairo University, and head of the public health department. For me, I understand it as the fairness and the dignity with which everybody has the right to be healthy and to access all the activities, all services, and all the available resources that would lead to health.
My name is Margot Skarpeteig, and I work in NORAD, the Norwegian Agency for Development Cooperation in Oslo. Collaborative approaches is so important, I think. You know, it's just basic to ensure participation of all stakeholders to be able to ensure the different human rights. In meetings like here, where we have different stakeholders with different approaches, different needs and priorities, I think it's so important to come together and talk to be able to, make sure we are going and moving in the same direction.
Roberto Yunis. I work at the WBI, World Bank Institute, on health systems practice. Okay. I'm a senior health economist there. The right to health and other rights are a reflection of a social contract that exists in a country or in a specific setting. And that social contract can only be represented, it needs to be represented actually, by all key parties that constitute that social contract, that have a major role in establishing that social contract. So if we're only working with one of the parties, we're not reflecting that social contract. So in that sense, we would not be understanding what that social contract is. So we cannot do that in isolation and working without a multi-stakeholder approach.
I'm Manu Devar. I am from Washington, D.C., and I'm an attorney in private practice at a law firm called Arnold & Porter.
That's the only realistic way to solve problems in the world today.
By prioritizing, we decided, or we identified that one of our major deficiencies in the health system is the lack of governance. So we're working to provide a framework for better governance that would support and strengthen the health systems in a way that would cover the defects or the deficiencies that leads to inequities, inefficiencies, lack of access to quality of healthcare services. And these are things that could be overcome by developing this framework and by engaging different stakeholders from the private sector, from the governmental, non-governmental organizations. We need to continue the dialogue about this and how we can restructure it in a way that would support and strengthen the health system.
My name is Anne Jogu. I am from Kenya, and I work for a women's human rights organization known as the Center for Rights, Education and Awareness, as well as a media for communications development known as Africa Community Development Media. I think automatically it would mean that Kenyans will be able to realize that one of their critical rights under the Constitution, which is the right to life. You cannot have life without health.
I'm Al Mully. I am from the United States, and I work at Dartmouth, where I am a professor of medicine and director of the Center for Healthcare Delivery Science. It's kind of a dual positive effect. You engage the most underutilized resource in healthcare, the patient and the public. And by doing so, by engaging them, you also get this benefit of what Marmot called the status syndrome. They're feeling more autonomous, and more autonomous people, regardless of income, generally have better health.
So for me, the right to health lies at the core of the kind of nation that we must build where everybody is benefiting, where everybody is participating, where everybody is contributing, where everybody is realizing their various contributions, building the kind of Kenya that we want. And therefore, being a responsible global citizen to the rest of the world, where every citizen being fully in great health is able then to be a good citizen to our neighbors as well as to the global community.